Bismillahirrahmanirrahim. Acha. Question number 73. 1 year post heart transplantation. Follow-up chest radiograph shows multiple nodules of varying sizes with enlarged hyaline lymph nodes. Diagnosis. Acha. This is lymphoma. Now, chest radiograph shows multiple nodules. Here shows multiple nodules of varying sizes. Chest or CT scan shows multiple nodules of varying sizes with enlarged hyaline lymph nodes, or more enlarged left hilum. Diagnosis post transplantation lymphoproliferative disease or lymphoma. Since post-heart transplant or post-transplantation lymphoproliferative disease. Question 74. Ultrasound scan shows a rounded 2 cm low aqueous-density lesion layered to a branch of the hepatic artery. This was arterial type flow throughout on Doppler. Which minimum is in treatment option should be offered? Transcatheter coil embolization. Because ultrasound scan shows 2 cm low aqueous lesion layered to a branch of hepatic artery. I think this is post biopsy also. This was arterial type flow throughout the Doppler, so this is a pseudo aneurysm following biopsy procedure, and treatment is transcatheter coil embolization. On ultrasound, when there is a lesion having arterial type flow throughout the Doppler imaging, and it is post biopsy aneurysm, so minimum invasive treatment is transcatheter coil embolization. 75. Which lung segments are separated by superior axillary fissure? Apical segment of the lower lobe from other lower lobe segment. Superior axillary fissure separates apical segment of the lower lobe from other lower lobe segments. Superior axillary fissure separates apical segment of the lower lobe from the other lower lobe segments. Question 76. In normal anatomy, which vascular structure lies more anteriorly at the level of the thoracic inlet, posterior to the manubrium, left brachiocephalic vein? Normal which vascular structure lies most anterior at the level of the thoracic inlet, posterior to the manubrium, left brachiocephalic vein? Remember, like this, the heart is in the center, so above at the center will be the left brachiocephalic vein, and at the level of the thoracic inlet. Question number 77. Which of the following descriptions would be most suggestive of pulmonary hematoma imaging? Okay, here is pulmonary hematoma. Lobular 3 cm mass with calcification and fat and peripheral location. Pulmonary hematoma. What will suggest pulmonary hematoma imaging? Lobulated 3 cm mass with calcification and fat in a peripheral location. Lobulated 3 cm mass with calcification and fat in a peripheral location. Question 78. In position left side superior vena cava, drainage usually occurs into which structure? Coronary sinus. In position left side superior vena cava, drainage usually occurs into coronary sinus. In position left side superior vena cava, drainage occurs in coronary sinus. In position left side superior vena cava, drainage occurs into coronary sinus. Question number 79. 18-year-old male has tachycardia. 18-year-old male has tachycardia, nasal polypation and bronchiectasis with further investigation is considered fertility assessment. 18-year-old male has tachycardia, nasal polypation and bronchiectasis with further investigation is considered fertility assessment. The diagnosis is cardiovascular syndrome. Question number 80. CT scan shows soft tissue mass in the medial aspect of the left lung, invading the mediastinum between the aortic artery and pulmonary artery, which symptom may the patient have presented with hoarse voice. So the CT scan shows a soft tissue mass in the medial aspect of the left lung. This is the left lung. Between the aortic artery and pulmonary artery. This is aortic arch, the pulmonary artery, which symptom may the patient have presented with hoarse voice. Aortic arch, pulmonary artery between the lesion, patient will present with hoarse voice because that's the left lung hilum with the aortic arch. The soft tissue mass in the medial aspect of the left lung invading the mediastinum between aortic artery and pulmonary artery, which symptom the patient have presented with hoarse voice. 81. 65-year-old male presents with chest pain and is referred for myocardial perfusion imaging, so as he is unable to exercise due to osteoarthritis of his hips. He is known to have asthma requiring regular inhalers and often has wheeze. Which pharmacological agent should be used? Dopamine. This adenosine is contraindicated in asthma patients. So in asthma patients, which stress agent should we give? Dopamine. In asthma patients, which such agent do you give? Dopamine. In asthma patients, which such agent do you give? Dopamine. Question 82. Patient comes for myocardial imaging. Which pharmacology such agent? Uh, 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 which part told dopamine? Okay. Next one. On the scan, there's contrast. On the scan, there's contrast in the peripheral aneurysmal sac. Not in contact with the stent. Diagnosis type 2 endoleak. Okay. On scan, there is contrast in the peripheral aneurysmal sac, not in contact with the stent. Diagnosis type 2 endoleak. Now, at the end of the stent leak is type 2 endoleak. Type 1 endoleak is uh, type 1 endoleak is through the graft. Type 2 endoleak is at the edges of the graft. Type 3 endoleak is type 4 is through porous material. Type 5 is endotension. Type 2 is end leak. Type 1 is through the porous material. And this is also the type 3, 1, 2, 3, 4 porous material and 5. So type 2 endoleak is at the end. So the contrast in the periphery of the aneurysmal sac is type 2 endoleak. Question 83. In thoracic lymphoma, which feature would favor non-Hodgkin lymphoma or Hodgkin disease, predominantly posterior mediastinal lymph nodal involvement? In thoracic lymphoma, which feature would favor non-Hodgkin disease, lymphoma or Hodgkin disease, predominantly posterior mediastinal lymph nodal involvement? Thoracic lymphoma, which feature would favor non-Hodgkin lymphoma or Hodgkin disease, predominantly posterior mediastinal lymph nodal involvement? Question 84. Normal anatomy, which structure lies immediately anterior to the left main bronchus of the left hilum, left superior pulmonary vein? Now, in normal anatomy, which structure lies immediately anterior? Yes. Left superior pulmonary vein. This is correct. Which is normal which structure lies anterior to left main bronchus at the left hilum, left superior pulmonary vein. Which structure lies immediately anterior to the left main bronchus, left hilum, left superior pulmonary vein. Question number is again question 85. Which feature on CT would make recessive cardiomyopathy more likely to diagnose than congenital pericarditis? Normal pericardial thickness. In recessive cardiomyopathy, there is normal pericardial thickness. In recessive cardiomyopathy, there is normal pericardial thickness. 86. In adult patient, which structure along with the right atrium and superior vena cava form the right mediastinal border, right brachiocephalic vein? In adult patient, which structure along with the right atrium and superior vena cava, form the right hot mediastinal border, right brachiocephalic vein? Right brachiocephalic vein, superior vena cava, and right atrium form the right mediastinal border. Question number 87. In bronchopulmonary sequestration, which of the following features would be more susceptible of interlobar and extralobar type? Enclosed and visceral pleura. Interlobar sequestration, extralobar sequestration. Now, in bronchopulmonary sequestration, which feature would be susceptible of interlobar than extralobar type? Enclosed and visceral pleura. Interlobar sequestration, enclosed and visceral pleura. Extralobar sequestration has its own pleura. Question number 88. In an aortic arch, after the normal configuration of vessels, brachiocephalic, left common carotid, and left subclavian artery, which is the next most common configuration seen, common origin of the brachiocephalic artery and left common carotid artery. In the anatomy of the aorta, after the normal configuration of vessels, brachiocephalic, left common carotid, and left subclavian artery, which is the next most common configuration seen, common origin of the brachiocephalic artery and left common carotid artery. Next most common configuration of aortic arch, common origin of brachiocephalic and left common carotid artery. Question 69. Teratoma is suspected. Which feature on CT would suggest that the lesion is more likely to be benign? Calcification. In teratoma, which feature on CT would suggest the lesion is more likely to be benign? Calcification. In teratoma, which feature on CT would suggest the lesion is more likely to be benign? Calcification. Question 19. Embolization is done 24 hours later. CT scan shows an area of lack of enhancement involving the tumor and adherent urinary parenchyma, which locules of gas within this area, diagnosed post-embolization syndrome. Post-embolization 24 hours. CT scan shows lack of enhancement involving tumor and distant parenchyma with occlusion of gas. Diagnosis: post-embolization syndrome. Question 921. Which feature would suggest underlying sarcoidosis as more likely diagnosis than rheumatoid lung mid-zone predominance of reticulation? These sarcoidosis on PET scan. The Panna sign and delta sign. And lambda sign. So Panna sign, lambda sign. Now, which feature would suggest sarcoidosis likely diagnosis in rheumatoid lung mid-zone predominance of reticulation? Mid-zone predominance of reticulation. In sarcoidosis, there is again mid-zone predominance of reticulation. It does not go to the periphery. Mid-zone predominance of reticulation. In the sarcoidosis, there is mid-zone predominance of reticulation. Question 92. What is the dose for CT pulmonary angiogram relative to a VQ scan? CT pulmonary angiogram has a higher total body dose but a lower uterine dose. What is the dose of pulmonary angiogram relative to a VQ scan? CT pulmonary angiogram has a higher total body dose but a lower uterine dose. Question 93. Appearance of pulmonary heart disease: solitary oval mass with air fluid levels and floating tubules. The liver abscess, the heart disease. Liver abscess, heart disease. Appearance of pulmonary heart disease: solitary ovoid mass with air fluid level and floating tubules or multiple tolerances. So, question 94. The statutory graph shows erosion of the lateral end of clavicle, superior notching of the third and fifth ribs, and narrowing of the humeral acromion space. Diagnosed rheumatoid arthritis. Statutory graph: erosion of the lateral end of the clavicle, superior notching of the third to fifth ribs, and narrowing of the humeral acromion space. Diagnosed rheumatoid arthritis. Question 95. In left lower lobe of the lung, the bronchi, to which segments share a common origin? Anterior basal and medial basal. Okay. In the left lower lobe of the lung, the bronchi, to which segments share a common origin? Anterior basal and medial basal. Anterior medial, so anterior medial, anterior basal and medial basal. Bronchi of anterior basal and medial basal share a common origin. Question 96. Angiography shows multiple stenosis of the renal artery bilaterally with normal aorta. Which therapeutic option should be offered? Angioplasty. Diagnosis: fibromuscular dysplasia. We have fibromuscular dysplasia. Angiography shows multiple stenosis of the renal artery bilaterally with normal aorta. Diagnosis: fibromuscular dysplasia. Therapeutic option: angioplasty. Question 97. On HRCT of the chest, how can mosaic protrusion be distinguished from contrast appendicular? Lucent areas have abnormally small vessels. So on HRCT, the chest, how can mosaic protrusion pattern be distinguished from contrast appendicular? The lucent areas have abnormally small vessels. Now this will be like in mosaic pattern, and there will be chronic thromboembolism, so the lucent areas will have abnormally small vessels. Question 98. History of ventricular arrhythmia, dyspnea on exertion, with no peripheral arterial cyanosis, and the heart size normal. Diagnosis: amyotrophic pulmonary disease. The patient has history of ventricular arrhythmia and also treatment. He has dyspnea of exertion. There is no peripheral arterial cyanosis, and heart size normal. Diagnosis: amyotrophic pulmonary disease. Question 99. Which feature on HRCT would make silicosis more likely diagnosis than sarcoidosis? Because massive fibrosis. Which feature on HRCT would make silicosis more likely than sarcoidosis? Progressive massive fibrosis. Progressive massive fibrosis seen in silicosis. Multiple sausage-shaped masses parallel to the mediastinum. Question number 100. Patient has hemoptysis and renal failure. Appearances on chest radiograph subsequently progressed to an intestinal pattern. Diagnosis: Fitzpatrick syndrome. Patient has hemoptysis and renal failure. So appearances on chest radiographs progressed to an intestinal pattern. Diagnosis: Fitzpatrick syndrome. Hemoptysis plus renal failure seen in Fitzpatrick syndrome. अच्छा ठीक है, next paper start करो.